Welcome to Module 2 on the medical options for pregnancy releases. What are the different medical options for abortion and or pregnancy release? A medical abortion or pregnancy release, a surgical abortion or pregnancy release, or an alternative holistic pregnancy release using herbs with a possibility of needing misoprostol to help expel the contents of the pregnancy. Herbs work 40 to 60% of the time and need to be taken for up to 2 weeks generally. A bereavement doula can help with expected management, as the miscarriage with herbs can take up to 2 months to expel the pregnancy, if the woman wishes to choose this process, of course. Ren Peterson believes that this form of a pregnancy release is completely within your control, and you are taking full responsibility for your pregnancy termination or miscarriage. This can and is empowering for many women. Medical pregnancy release abortion. RU486 is often taken before a woman even knows she is pregnant. It's often known as the morning after pill, often used after having unprotected sex as an assurance that no pregnancy will take place. RU486 is now available over the counter in stores such as Walmart and Target. If she knows she is pregnant and chooses to take this medication to terminate, she will often take this at the doctor's office and be given another drug, misoprostol, to terminate the pregnancy. But not always. Again, if it's used as an after morning pill, she can take it at home. When taken in combination with misoprostol, it is 95% effective in terminating the pregnancy. Mifepristone works by blocking the effects of progesterone and causing contractions of the uterus. As you can see, a doctor may use it up to 63 days or 9 weeks, although its effectiveness is diminished after 7 weeks. RU486 is best used as soon as one knows they want to end the pregnancy, and up to 7 weeks after the date of the woman's last period. Surgical pregnancy release and abortion. All surgical abortions are done in a healthcare provider's office or a clinic setting. 24 hours prior to the procedure, a woman may have laminarius sticks inserted into her cervix to expand the cervix enough for a tube to fit through and go into the uterus. These laminarius sticks are made of seaweed and expand as they absorb moisture. The doctor may also choose another method of softening the cervix, such as Cytotec, which is used often before inserting an IUD, for example. Dilation and aspiration, a DNA, involves the insertion of a tube through a dilated cervix into the uterus. Gentle suction removes the fetal tissue and empties the uterus of the pregnancy. This is now the more preferred method of a surgical abortion, as it is more gentle than a D&C. Here is a slide illustrating the use of a cannula, which is an electric vacuum suction. This is more commonly used in a private doctor's office setting under general anesthesia. This is a manual vacuum aspirator called an MVA, and this is typically more commonly used in a clinic setting, often without general anesthesia. The procedure of a D&C is often confused with the procedure of a D&E procedure. A D&C is less popular, and most doctors use the electric or manual aspirator now. The D&E involves other instruments, such as forceps, along with suction to empty the uterus. In later second trimester abortions or pregnancy releases, sometimes a shot needs to be administered through the abdomen or cervix into the baby or into the fetus, and it ensures that the heartbeat will stop before the D&E begins. In the next module, I will show you a 28-week termination where the woman birthed her deceased baby. Not all terminations are aspirated. This ends Module 2 on the different medical options for pregnancy release. Please continue on to Module 3, where I will discuss the role of a bereavement doula and preparing the woman for a pregnancy release with the use of ritual.